If you have knee arthritis, you've probably wondered about a shot. A cortisone shot, the gel injections, PRP, maybe even stem cells. And you want to know one thing: what actually works and what's just marketing? Here's my honest answer. Some of these injections are genuinely useful, but one of them I tell patients to skip completely. And none of them should be the first thing you try. Let me walk you through each one the way I would if you were across the desk from me in clinic. Before we talk needles, let's start with what you can do yourself. Movement is the foundation. Exercise, strengthening the muscles around the knee, keeping your weight at a healthy range, and maybe the simple over-the-counter anti-inflammatories when it's safe for you. I want you to get those right first because injections aren't free. I don't mean money. I mean, every one of them has a trade-off. So we earn our way up the ladder. You do the basics, and then we add a shot if you still need one. And here's the part most of us miss. A shot isn't a replacement for the basics. Even after an injection, you need to keep moving, keep strengthening, keep your weight in check. The shots work best when it's buying you room to do those things you love. Let's start with cortisone, the steroid shot. It's the workhorse, and for good reason. In my practice, it helps as many as 9 out of 10 people. So how long does it last? Now here's the hard part. For some people, it lasts a day. For others, a week, maybe some even up to a month or several months. It's a great tool, but it's not one that's free. Too much cortisone, too often, has a cost. We believe frequent steroids into the knee, for example, can wear out the remaining cartilage, and it can be hard on the surrounding soft tissues too. I'm talking about the tendons and ligaments. And there is good data behind that caution. It's not just being scary. One trial gave a steroid shot every 3 months for 2 years and compared that to saltwater placebo injections at that same frequency. The steroid group lost more cartilage and got really no better pain relief over the time of the study. So I don't hand these out endlessly. My routine is only up to 3 times a year per joint that we're talking about. At that pace, for most people, it's safe and a useful tool. We just respect it. Next up is hyaluronic acid, or as it's said in a commercial, hyaluronic acid. Most people just call it the gel injection or even the chicken shot because we harvest the active ingredient from rooster combs, believe it or not. Here's how I explain this shot to patients. We put a gel into your knee. The cartilage you still have left soaks it up like a sponge would absorb water. And that helps your own cartilage act as a better shock absorber. Now, that's a simplified picture, and the real mechanism is probably more complicated than that, but the idea is right. It helps the cartilage you have work a little better for you. One thing it does not do is grow new cartilage. In my practice, about 8 out of 10 patients see relief for 6 months and sometimes longer. Some get relief for up to 2 or 3 years. But it works best if you still have cartilage left. So for mild to moderate arthritis, once you're bone on bone, these gel injections are less likely to help. And here's where I'll be straight with you. The American Academy of Orthopedic Surgeons does not strongly recommend these gel injections. The published evidence is genuinely mixed. So this one is one where I sit a little apart from the guidelines. Because in my practice, a lot of patients I see respond very well to these injections. And in my region of the country here in the US, insurance still covers it. One more practical note I should tell you. For these gel injections, you can see a 1-shot, a 3-shot series, or even a 5-shot series. Your insurance will have an opinion on which one is approved for you. And this is one thing I don't fight with the insurance companies a lot about. The active ingredient in all these injections, 1, 3, and 5, are the same. So whether they approve a 1-shot or 3 or 5, the evidence says you'll do about the same. You'll do well. Now on to PRP, platelet-rich plasma. This one works differently from the first two. Cortisone and gel manage the joint. Cortisone to control the swelling, the gel to encourage or improve the health of the cartilage you have left. But PRP calms the inflammation inside the knee. So we take a little bit of your blood from your arm, obviously. We spin it down to the concentrate. This includes the platelets and some growth factors, and then we inject that back into your knee. A few important things you need to know though. PRP is not covered by insurance, and some clinics charge you a lot of money for it. So in our clinic, we charge what the kit costs, so no extra amount of money. We don't mark it up. The evidence here on PRP is still evolving, and it is also mixed. One large, high-quality trial compared PRP with saltwater placebo, and they found no real difference in pain in the joint itself at 1 year. But in my practice, I see about 7 out of 10 patients get some relief for 6 months or even longer. So I do offer it, but I want you walking in with your eyes wide open. I want you to be a smart shopper. Not all PRP is the same, by the way. The preparations surgeons can use are different. Some have high white blood cell count and some have low, and that difference seems to matter in the literature. It's fair to ask exactly what you're getting and why they're using those injections. And one more thing that bothers me, some places will tell you they're giving you stem cells and what they're actually injecting is PRP. So they're drawing your own blood. That's a PRP injection. Those are not the same thing, so ask. Which brings me to stem cells. And here's where I probably need to be blunt because you deserve it. For global knee arthritis, there's no credible medical evidence that stem cells work. A recent review pulled together 16 randomized trials. It found that stem cell injections probably give little or no relief in pain or function and may actually raise the risk of side effects. The marketing says they'll grow new cartilage, and that just simply has not been shown. Maybe someday we'll prove it. Maybe someday we'll get there. I genuinely hope so, but we're not there yet. So I say it this way in clinic. If stem cells were free, I'd tell you not to do it. And it turns out they're not free. They're very expensive. People are spending huge amounts of money on a promise that just isn't real yet. That's one thing I probably shouldn't stay quiet about. Now, a fair caveat. There are narrow, specific uses of these kind of biologics, like focal cartilage defects in a younger patient. That's when we use stem cells. But that's a different situation. But for broad bone-on-bone arthritis, stem cells do not have evidence behind them. So, how do I pull all of this together for you? You start with movement, weight, and simple anti-inflammatories. Use cortisone when you need it, but with respect and only a few times a year. Consider the gel, especially if you still have cartilage left. Consider PRP, but go into it with your eyes wide open and don't overpay for it. And skip the stem cell sales pitch. Now, one more thing to keep in mind through all of this. None of these shots cure arthritis. The only cure for arthritis is replacing the joint. But there are good non-surgical treatments for the symptoms, and surgery should always be a last resort. These injections can buy you good time and good function while you get there. None of that is failure. It's putting off surgery for a few good years with a shot that works for you, and that's a win. And in the end, it's really about quality of life. When you think about arthritis, if your pain and the limits you have were taken away, how much would your life change? When it's truly time to consider surgery, you'll know. So here's the short version. Earn your way up the ladder. Cortisone is a solid tool used with respect. The gel shots can help, but we need cartilage to be left for them to have their maximal benefit. PRP, listen, if you go to PRP, go in with open eyes. And stem cells for arthritis, not yet. If you want to walk through your own knee and what actually makes sense for you, there's a link to schedule a visit in the description below, and also some deeper articles about each of these injections. Thanks for watching.